Chickenpox is a highly contagious viral infection caused by the varicella-zoster virus, VZV. It is characterized by an itchy rash and fluid-filled blisters that can spread throughout the body. The disease is typically more severe in adults than in children. Treatment for chickenpox is focused on relieving symptoms, such as fever and itching, while the body fights off the infection. This may involve taking antihistamines or using calamine lotion to soothe the skin. In some cases, antiviral medications may be prescribed to reduce the severity and duration of the illness, especially in people who are at increased risk of complications. Vaccination is the most effective way to prevent chickenpox. Gastroenteritis is a medical condition that refers to inflammation of the stomach and intestines. The condition is typically caused by an infection with a virus, bacteria, or parasite. Symptoms of gastroenteritis include nausea, vomiting, diarrhea, abdominal pain, cramping, and fever. The treatment of gastroenteritis depends on the underlying cause of the condition. In most cases, the illness is self-limited and will resolve on its own within a few days without any specific treatment. The goal of treatment is to manage symptoms, prevent complications, and speed up recovery. If the patient is dehydrated due to vomiting and diarrhea, it is important to replace fluids and electrolytes lost through these mechanisms. This can be done by drinking clear fluids such as water, broth, or sports drinks that contain electrolytes like sodium, potassium, and chloride. In some cases, intravenous fluids may be required in a hospital setting. Antibiotics are not usually recommended for viral gastroenteritis, because antibiotics are only effective against bacterial infections, not viruses. However, if the cause of gastroenteritis is bacterial, appropriate antibiotics may be prescribed. In addition to supportive care, patients with gastroenteritis should practice good hygiene habits, such as washing their hands frequently, avoiding close contact with others who are sick, and properly preparing and storing food to minimize the risk of infection. It is important to seek medical attention if symptoms worsen or persist beyond a few days, if there is evidence of dehydration, or if there are signs of complications, such as blood in the stool or severe abdominal pain. Hand, foot, and mouth disease, HFMD, is a viral illness that primarily affects young children under the age of 5, but can also occur in adults. The disease is caused by one of several enteroviruses, most commonly Coxsackie A16 or enterovirus 71. The symptoms of HFMD typically begin with a fever, sore throat, and a loss of appetite. After a few days, painful sores may appear in the mouth, on the hands, feet, and sometimes on the buttocks. These sores usually start as small red bumps and develop into fluid-filled blisters. Along with this, the patient may experience a rash on the palms of their hands and the soles of their feet. There is currently no specific treatment for HFMD, and most people recover without any complications within 7 to 10 days. However, some treatments can help alleviate the symptoms. Over-the-counter pain relievers such as acetaminophen or ibuprofen can be used to reduce fever and ease discomfort. It is also recommended to drink plenty of fluids to prevent dehydration, particularly if there are sores in the mouth that make it difficult to swallow. Prevention is key to avoiding HFMD. Practicing good hygiene habits, such as washing hands frequently with soap and water, disinfecting common surfaces, and avoiding close contact with individuals showing signs of illness can reduce the risk of infection. Additionally, avoid sharing food, drinks, and utensils with others to decrease the chances of transmission. In rare cases where complications do arise from HFMD, hospitalization may be required. This is more likely to occur in severe cases where dehydration, difficulty breathing, or other complications have developed. If you suspect that you or a loved one may have HFMD, it is important to seek medical attention right away to receive proper diagnosis and treatment. An ear infection is a condition where the middle ear becomes inflamed, often due to a viral or bacterial infection. It can occur in people of all ages, but is most common in children. Symptoms of an ear infection include ear pain, fever, fatigue, difficulty sleeping, hearing loss, and a feeling of fullness or pressure in the ear. Children may also tug at their ears, have difficulty feeding, or be irritable and fussy. The treatment for an ear infection typically depends on the cause of the infection. If it's caused by bacteria, antibiotics may be prescribed to help fight off the infection. Pain relief medication, such as acetaminophen or ibuprofen, can also be used to manage the pain. It's important to complete the full course of antibiotics even if symptoms improve early, to ensure that the infection is fully treated. In some cases, when the infection doesn't respond to antibiotics or recurs frequently, surgical intervention may be necessary. To prevent ear infections, it's important to practice good hygiene, such as frequent hand washing, avoiding close contact with individuals who have respiratory infections, and keeping up to date with vaccinations, particularly the pneumococcal vaccine, which can protect against certain types of bacteria that can cause ear infections. It's important to see a doctor if you suspect you have an ear infection, as untreated infections can lead to complications such as hearing loss, recurring infections, and even damage to the eardrum or bones in the ear.